Hello, my name is Dr. Isabelle Benard and I'm a general practitioner at the Medical Chambers Kensington. I've been a GP in London for over 13 years. Today I thought I could speak to you about impetigo, which is a superficial skin infection caused by a bacteria called Staphylococcus aureus. Now, this bacteria is present on our skin, on our normal skin, in very small quantities. And occasionally, after a small cut or a graze, this bacteria will invade the superficial layers of the skin and cause trouble. This is what we call impetigo. This is very common in children, particularly if your child has eczema. The symptoms that you get with impetigo usually start with a small spot, a little whitehead, or a tiny sore, which is quite common around the nose or the mouth. Now, this little sore tends to spread quite rapidly and it starts oozing, gets a little bit wet, and then in the morning it is covered with a little crust which is quite yellow, and this is quite a typical sign that this is impetigo. Occasionally impetigo will cause blistering, which is a little bit more unusual. Now, the problem with impetigo is that it's extremely contagious, so it's quite easy to spread it to other people, but it's also quite easy to spread it from one part of the skin to another part of the skin. So if you have any concerns or queries, it's important to see your doctor, and your doctor will probably take a small swab of the infection to check that the bacteria is present and also start treating you. And if the infection is very local or small, it will be treated with topical antibiotics, with creams. If the infection is a bit more widespread, you will probably need to take some oral antibiotics for a week or so. Now, we also find that some people get recurrent infections because they harbour the Staphylococcus aureus in their noses, so we occasionally also need to treat the nostrils with antibiotics. Some tips about, when you have the infection, what can you do to help yourself? It's very important that you wash your hands very regularly, particularly if you've touched your skin or the infected sores, because you don't want to spread it to other places. It's important not to share your towels and to wash them very regularly because, again, the infection will be present on the towels. When a child has impetigo, we generally advise that he avoids being in school at least for 24 to 48 hours while he's taking the antibiotics for them to really kick in so that he can stop spreading the infection to other children. And I think the best tip really is if you have a small graze or a cut, make sure that you wash it with soap and water, maybe put a touch of antiseptic on it and cover it with a plaster to avoid getting the impetigo and the Staphylococcus aureus. Many thanks for watching this video.